We will start off with some facts about immunization in the United States. There are 14 vaccine-preventable diseases that continue to plague children in the United States. Parents are choosing not to vaccinate or to delay vaccinating their children. Non-medical exemptions have steadily increased over the past 20 years. A majority of the children who were contracted measles in 2014 while at Disneyland were intentionally unvaccinated. States who have a higher incidence of pertussis are also those states with the easier vaccination exemption policies. In the last 10 years, there has been an increase in pertussis that hasn't been seen in over 5 decades. If you hear 106 degrees, you probably think heat wave, not a baby's temperature. But for Megan Campbell's 10-month-old son, a life-threatening bout of measles caused fever spiking to 106 degrees and sent him to the hospital. After picking our son up at childcare because he had a fever, Megan said, "We went straight to our pediatrician who said our baby had a virus. 2 days later, his fever hit 104 degrees and a rash appeared on his head. The rash quickly crept down to his arms and chest. Megan and her husband Chris turned to the internet. Finding pictures of measles that looked like their son's rash, they rushed him to the local children's hospital. No one there had seen or tested for measles for about 17 years, says Megan, and no one expected it in the year 2008 in the United States." Here we have a picture of the typical rash that presents with measles. The next day, an infectious disease specialist confirmed measles. We spent 3 days in the hospital fearing that we might lose our baby boy. He couldn't eat or drink, so he was on an IV, and for a while he seemed to be wasting away. When he began to be able to drink again, we got to take him home. But the doctors told us to expect the disease to continue to run its course, including high fever, which did spike as high as 106 degrees. We spent a week waking at all hours to stay on schedule with fever-reducing medications and soothing him with damp washcloths. Also, as instructed, we watched closely for signs of lethargy or non-responsiveness. If we'd seen that, we would have gone back to the hospital immediately. Thankfully, the baby recovered. Thanks to the widespread use of a safe and effective vaccine, the number of reported measles cases in the United States is now, on average, less than 100 a year. Worldwide, measles still cause 164,000 deaths each year. There is no drug to cure measles. We live in a global society, and even if your family doesn't travel, you can still come into contact with travelers anywhere in your community. The risk of MMR, measles, mumps, and rubella vaccine is causing a serious side effect is rare. All reputable studies have found no link between the MMR vaccine and autism. Experts calculate that measles alone can cost the public healthcare system more than $10,000 to $20,000 for each occurrence. Measles vaccines save lives. Here's a video showing the classic whooping cough that comes with pertussis. Pertussis is known as whooping cough because of the whooping sound that is made when gasping for air after a fit of coughing. Pertussis can cause serious illness in babies, children, teens, and adults, and even can be life-threatening, especially in babies. Approximately half of babies less than 1 year old who get pertussis need treatment in the hospital. Worldwide, there are an estimate 16 million of pertussis and about 195,000 deaths per year. Since the 1980s, there has been an increase in the number of reported cases of pertussis in the United States. The most effective way to prevent pertussis is through vaccination with DTaP for children and Tdap for preteens, teens, and adults. Why are parents choosing not to immunize their children? Concerns about safety of vaccines, inability to afford the cost of vaccines, influence of popular personalities seen in the media and on social networks, or all of the above. The first myth about vaccines is that vaccines cause autism.
But I was watching something on TV about somebody was talking about how vaccines cause autism. I mean, do vaccines really cause autism?
Well, autism is a very serious disease. It's heart-wrenching for families, and I think one problem is that we don't know very much about the causes of autism. There have been a number of studies that have looked at the link between autism and vaccines, either the measles, mumps, rubella vaccine, or thimerosal, that's a preservative that was in a number of childhood vaccines up to 2002. And in fact, those studies don't show any link between vaccines and autism.
The second myth is that you can delay your child's vaccines.
I have another question that's sort of related. I mean, I understand why we have to have a number of vaccines, but how about the schedule that the doctors follow? Is it really appropriate for every child?
Even though there's only one childhood immunization schedule, it actually takes into account the differences between children depending on their health or medical conditions. Sometimes parents ask about delaying the vaccines in the schedule, and I think it's really important for parents to understand that that can place their children at risk for getting these serious diseases.
Myth number 3 is that nothing will happen if I choose not to vaccinate.
What happens if we stop vaccinating? Do these diseases really come back?
The diseases absolutely will come back if we stop vaccinating. We've seen that over the past couple of years with outbreaks of mumps and measles. There was a story of a little girl who was from Indiana. She and her family went and traveled to another country. She wasn't vaccinated. She came back with measles to the United States. And because of her, she was in contact with more than 30 people who developed measles. 3 of those people had to be hospitalized, and 1 even went to the intensive care unit.
Herd immunity is the tipping point or threshold at which immunization levels are just above the point of being ineffective in preventing vaccine-preventable diseases. In other words, when a critical portion of a community is immunized against a contagious disease, most members of the community are protected because there's little opportunity for an outbreak.
That's what's known as herd immunity. Once enough people are immunized, then there really can't be an outbreak. If enough people aren't immunized and someone gets sick, the disease can then spread. More people get it, more and more people are exposed, and that's how you get an outbreak. That's bad. But if lots of people are immunized, then even if someone gets sick, the likelihood of anyone else getting sick and spreading the disease is really low. That's good. And if there can't be an outbreak, then everyone is protected, even those who can't get vaccinated. This is critical because there are people who are at increased risk for communicable diseases, but they can't be given shots for various reasons. Small babies, for instance, are susceptible to certain diseases, but they can't be given all vaccines. The elderly can have potentially impaired immune systems and be at higher risk for diseases, and the same goes for all immunocompromised patients, who are always under the threat of infection. We get so caught up in the discussion about how vaccines protect those who get them that we sometimes fail to focus on the other important reason immunizations are important. They allow us to protect those who cannot protect themselves.
The fifth myth is that herd immunity will protect my unvaccinated child. The trend of international travel is growing quickly, so even if a disease is not a threat in your country, it may be common elsewhere. If someone were to carry in a disease from abroad, an unvaccinated individual will be at far greater risk of getting sick if he or she is exposed. There will always be a portion of the population, infants, pregnant women, elderly, and those with weakened immune systems that can't receive vaccines. You may be thinking, what if I can't afford to get these vaccines? Vaccines for Children is a federally funded program that provides free vaccines for all 50 states. Children who are eligible are those who qualify for Medicaid, are uninsured or underinsured, meaning that their insurance company does not cover those required vaccines. These vaccines for children can be found at most pediatricians' offices and public health department clinics. To find resources in your particular state, click the link below. True or false? Vaccines cause autism. True or false? Delaying my child's vaccines won't put him at risk. True or false? Enough people around us are immunized. I don't have to worry about my unvaccinated child getting the disease. True or false? There are places in my state where I can get free or reduced cost vaccines. Don't wait. Vaccinate. Thank you so much for listening to our presentation.